Good evening, students. Welcome back to our channel, Ach'z. Actually, today in this section we are going to discuss about the complete prediction, or I like to suggest some topics you need to prepare under writing, reading, listening, and speaking module for OET exam on 5th of April 2025. Okay, so this section is for nurses. So I like to suggest the possible topics and the question suggestion for each skill. I hope you understood what about the video. So recently only we started this particular segment, and many students mentioned that it's really helpful. They will get an idea about what to prepare or what to concentrate and all. So this is not for any particular country. Okay, if you are planning to give OET exam under nursing category on 5th of April means try to concentrate on these topics. So let's start with our section without any further delay. So first of all, we will start from the listening module. I don't want to mention the general or the format and all, because in most of the videos I'm repeating that. So if you are ready for your exam means definitely you know the format or the categories and all. So directly we will discuss some topics you need to concentrate. So under listening module, first topic is about the patient consultation. So under that, you need to concentrate on how to manage some chronic conditions like asthma, diabetics, hypertension and all. And the second thing, post-surgical recovery instructions like the hip replacement or related to any wound care or wound healing. Then the next one is medication side effect or the adherence issues. So that comes under patient consultation, or you can expect the talk like that. The second category is hospital presentation. You know that in part B and C and all we can expect this type of audio. So the first topic is the new infection control measures. Then they can ask about this prevention strategies. That means the fall prevention strategies for this elderly patient and all, the usage of this side bed rails or the seat races, okay, or the caution board like that things, and the safe handling of the patient with mobility issues. And the third topic is nursing workplace discussion. Under that, the shift handover between the nurses. Then that can be the guidelines for any medication administration, especially the senior junior nurses like that. Then dealing with the confused or the aggressive patient. And the last topic is health education related talk. So under that, it can be like the lifestyle changes for any cardiac patient, and it can be like importance of this mental health for the healthcare professionals, and about the vaccine or related to the misconception related to the vaccination. So these all are the topics you need to give more attention towards. Try to select the audio which including these content. Then the possible questions, as you know, in part 2A, it will be like any consultation notes. You need to fill the patient history notes and all. And the part B will be like the workplace extract, and you need to answer for the multiple choice question. And part C will be like healthcare presentation. For that only, I suggested some topics previously. Okay, so now we will move on to the next module, reading. In that, the part A, that will be the quick information extraction. We already done so many mock tests concentrating on the part A especially, because many students find the part A little bit difficult, and that's why we are creating more mock test based on that, so you can just practice by yourself. And we are selecting the topics which are very relevant for the exams or which recently asked. So try to move on with our playlist and just practice a mock test. Then you can also understand your level. Sometimes you will repeat the same extract, means that's better now. Now about the part A section, that may be related to the guidelines for any wound dressing. Then the hospital discharge instruction they can give about the post-surgery care, or that may be any instruction related to any medication administration or related to the insulin administration. Coming towards the part B section, you know that workplace document. So that may be any memo on the patient safety protocols, or that can be any hospital policies to prevent the patient fall, or to prevent the infection, that means related to infection control protocols and all. And that can be the nursing guide to dealing with some aggressive patient or the dementia patient. And coming towards the part C section, you know that it will be a long test on the healthcare issues. So you can expect the topic like the impact of burnout in nurses and the strategies to manage the stress or the emotions. Or it can be like the advances in the stroke rehabilitation and also the patient outcomes. Or that can be the role of these machines or the robots in the elderly patient care. Okay, so these type of topics are very relevant nowadays. So coming towards the possible question, you need to concentrate more on this author's opinion based questions, especially in part C section. Coming towards the writing module, this time you need to concentrate much towards this referral letter rather than any other category. But I like to suggest some topics you need to prepare under this discharge, transfer, or what else. First, about this referral letter, you must practice with the referral letter of a diabetic patient to an endocrinologist. That is very common and repetitive topic, we can say. Or the patient with the chronic lower back pain, we need to suggest to the physiotherapist. Okay, and coming towards the discharge later, again I would suggest some topics under that. Discharging a patient after this appendectomy for this home care instructions and all. Or the stroke patient, discharge of a stroke patient, you need to recommend to the speech therapist and all. Under this transfer later, transferring a patient with the chronic kidney disease to any dialysis center unit. Or the moving of any elderly patient with the long-term dementia to any care unit like long-term care facilities. So that's all are the topic you need to focus towards. Coming towards the speaking section, the topics like patient education, again one of the common topic, like how to use the inhaler, or about the dosage of insulin, or that can be related to any lifestyle modification or the diet modification. So the second topic is like providing reassurance to the patient. The patient is planned for any colonoscopy and also you need to reassure the patient will be anxious and stressed, having lot of queries. So you need to comfort the patient. Or the patient starting with any new medication and really scary about the side effects or what all things or why they are taking that medication. So you need to reassure the patient related to any medication or related to any procedure. Then the third scenario is like the advices to the caregiver or the family member, the patient with the dementia. So how to take care them in the home setting, what are things they want to focus towards. Or the patient with the hip surgery, again what about the aftercare, so when they want to come back, and what about the physiotherapy sections. So like this scenario you need to focus more towards. I hope you got an idea about what to concentrate on 5th April on your exam. And overall in the listening section you need to practice with some real life conversations. You need to hear some podcast or the OET listening videos from the YouTube, because there is now much more time. So rather than just hearing another type of videos, you need to focus on the exam related audios. That will be far better during this limited time. And for this reading module, definitely you need to practice with the skimming and scanning method. Previously also we discussed and we already updated some tips and tricks related to the reading module and all. So you need to practice with some hospital guidelines or some policies or some articles, apply the skimming and scanning method over there. And for this writing section, rather than just writing each and everything or irrelevant data, you need to focus on how to select the relevant data, how to report that using proper vocabulary, about your sentence construction, your grammar. Okay, these all things you need to focus more towards, especially during the end of the preparation. And by last, for the speaking section, I think we already updated some common phrases which you can use under this speaking section and all. You can just cross check our playlist. You will get more tips and tricks or the easy methods or the common phrases you can use, which is in the advanced level to improve your band score. So you need to focus on the vocabulary, your phrases, that also the tone. You need to be empathetic in nature, you need to comfort the patient, answer should be in the proper way. That also again grammar is a matter. So these all things you need to focus. It's better to study some phrases or some vocabulary in common which you can apply under different scenarios. So for that, it's better to go through the playlist and study some phrases based on the updated format. So that's it about the 5th of April. I hope this video will help you out to get a guideline or what you can expect in your real exam. So try to convey your experience soon after the exam. Definitely we will come out with the review section, and tomorrow also we have OET exam. So by evening you can expect the review video. There we will discuss the available question paper from different time zone. So all the very best for your exams, and thank you so much for your time over here. And don't forget to subscribe, because many of them are saying that they are not getting notifications. Simply watching the video and moving means you will not get a notification. So try to subscribe and switch on the bell icon to enable it for all the notification. Then you will get the notification and you will not miss out any of the information or the updates. So thank you so much and stay tuned, and God bless you all.